Okay,
Started recording.
so thank you very much for being here today. My name is Luis Marrero. I'm the chair of the Health Committee. And something that we always do, and I'm not sure if it's going to work here, we always go around to so everybody can introduce themselves. At least we know who's there, because I know some people are on the phone and some are on the website. So we can go. We can start by Ralph.
Ralph Acevedo, District Manager for Board 2. So, Louis, do you want me to announce who's here presently?
Okay.
Or
Okay. So everybody knows. I just want to know. I just want to make sure everybody knows who's part of the meeting.
Sure. So we have myself. We have the community coordinator, Cynthia Baez. We have Gabriel Torres from Urban Health. I have Anita Reyes from the Department of Health and Mental Hygiene. We have a brand new board member, Jennifer Kalman. She's from Open Arms Circles, the senior daycare in our district. Yourself, the health chair, Luis Marrero. We have Mariel de la Cruz from the New York Control Office. We have Paloma Hernandez, President CEO of Urban Health Plan. We have a new board member, Shatori McCoy Gregg. I hope I pronounced that correctly. And you have a committee member, Stephanie Cordero, here. So you have, besides yourself, have another three board members on here with you, Louis. As of now. So.
The connection.
That's okay. You're there.
Okay. So let me put this in airplane mode, because when somebody calls me, everything goes away. So first of all, today is October 6th. We haven't met since March last year. Then we went into recess during the summertime, and last month we were still early to meet, and finally we have the opportunity to meet. And today, what I really want to do, health is an issue right now that is so important, and what's going on in the community with COVID-19. I know we have Anita in our full board meeting. She did a pretty good and thorough presentation about COVID and what the city is doing in terms of COVID. But within the community board too, we have one of the biggest employers of service in healthcare, and I think it's a really great idea to bring Urban Health Plan, and since they're the biggest community health center in our district, they can give us an update or let us know what you're doing, how you're doing. If you need anything from the community board, how can we support the work that Urban Health is doing? So for that, we have the CEO and president of Urban Health Plan, Ms. Paloma Hernandez, that she's going to be addressing some of the issues. Thank you, Paloma, for being here.
Thank you.
1 second. I'm sorry, Paloma. Mr. Chair, I just also want to acknowledge that you joined by First Vice Chair Julia Cruz is also on the line.
Okay, thank you.
I'm sorry, Paloma.
Oh, that's okay. So thank you for inviting me. These are very difficult times that we're all living through right now. I don't think any of us ever imagined doing these meetings, like I said, looking at each other through squares for so long, but here we are. So Urban, I can tell you, that Urban is a very large provider in Planning Board 2 with many sites and many school sites as well. And so we struggled like everybody else did in the very beginning because our visits really are dependent on in-person interactions, right? So you never had anything called telehealth, even though we were all kind of prepping up for it, but we never really put it into place. And what we did was we found ourselves in our main site as an example, or organization-wide, where we had, let's say 8,000 visits a week. All of a sudden in March, they dropped to 800 visits a week. And so there was like, how are we ever going to exist? And the government was very reluctant to help pay for, or to be willing to pay for telephone encounters. So whatever telehealth you did, you had to do through video. And that works, except it doesn't work for our older population, people who don't have smartphones, people who have bandwidth issues, all those people. And so in between trying to keep the organization afloat, we also had this whole policy thing going on with the state and hoping that we could get paid. If not, health centers across the city, across the country, would have just shut our doors. It was really at that point, and all of the focus was on the hospitals, as it should have been, but no one was looking at the primary care providers on the ground and trying to figure out how do we keep some semblance of a healthcare system that wasn't going to be flooding the emergency rooms at that time, back March and April. We overcame that, and we got them to we got the state, as part of the emergency orders, to actually reimburse for telephone visits, which has been very helpful. And so I guess we started really. We also, our staff, we have, let's say, roughly 1,000 staff members. 270, 75 of them, kind of like a third. A third were furloughed, a third worked remotely, and a third stayed on site. And that's kind of how it divided up.
Do you want to hear your boss?
Excuse me?
No, I'm sorry. Go ahead. Sorry.
Oh, okay. And so we had a workforce plan, and then I guess in late May, early June, we kind of started seeing that this was going to be our new normal, and how did we start ramping back up? And so we put, the first thing that we really looked at was our physical environment across all of our sites, and making sure that they were as safe as could be for patients and for staff. You know, the staff, as Julia knows because she works in a health facility, is a lot. I mean, people walk around all day long in PPE, and that's something that we don't, you don't think about. But when you have to wear those masks and gowns and face shields and goggles and gloves 8 hours a day, it's really something that we should really think about, the challenge that people have doing. We had closed down quite a number of services, and then we had to start thinking about how we ramped them back up. So assuring, one, that we had enough PPE was really important. Assuring that we could segregate our patients. So when patients come in, they're screened at the door, and if they're symptomatic, they're sent to another side at our main site. And so we've been able to really keep our symptomatic patients apart from our asymptomatic patients, taking temperature at the door, screening people at the door. We screen people before their visits, so the night before all of our patients get called to make sure that they don't have any symptoms or no one in their household has symptoms. If they do, then we put them on a telehealth appointment system. So at this point in time, I guess one of the other things we did was we kind of looked at our waiting rooms and our physical capacity, and figured out how many people could be in a given space at a given time. So through the use of a grid, which kind of tells you can't have more than X number of people based on what exam rooms, based on seating in your waiting room, coupled that with walkie-talkies, coupled with clickers, where we keep counts of everybody that's going into our facilities. We've been able to maintain right now what looks like about 49% of our visits are in person, where they were at about 8% in March or April. They've actually gone up to about 49%, and every week there's a little bit more. We're also opening more services that require in-person visits, and then with the remainder is still telehealth. So we do a whole lot of telehealth visits, and so the telehealth visits are actually divided up into video visits and telephone visits, with the telephone visits taking a little bit of a lead over all the other visits.
Where's my cat?
Oh, 1 minute. I don't know right now. And that was my granddaughter. Hi, granddaughter. And so then we started bringing in dental. So we always had two dentists who did emergency dental care throughout the crisis. We now are up to, I want to say, about 6 dental providers, and we are slowly bringing them back. We had to get suction machines for each of the dental operatories. A lot of preparation that has gone into making our facilities really, really safe. We opened up our physical therapy department, which we had closed up. We opened up podiatry, which we had also closed up, and we opened up our optometry service, which had been closed as well. So those were the 4 services that we closed down. Everyone was working remotely. We have started to very methodically and deliberately bring more visits in, and really, as I said, trying to always balance safety with capacity and making sure that is really maintained in a really thoughtful way. What else could I tell you? Every day gets a little better. I think that there's a lot of trauma and a lot of anxiety, a lot of stress that people have gone through, all of us. I really think that when this is said and done, either people are going to be totally nuts and go crazy and have the time of their lives, or we're really going to start seeing, and I think it'll be a combination, right? I think everybody needs to be around each other. I think everybody needs to hug each other. I think people need people, right? And so I hope that what we see is better for our community. I hope that we're stronger. I think that we've learned a whole lot about ourselves, about the people that we serve, about the disparities that exist. None of the disparities are very unfamiliar to me. I've lived them all my life. Yeah. So let me stop there. Let me just also say, and I do get, all of you know me, you know how emotional I get, but it's because the human factor is such a big deal in all of this, and humans are resilient, and we survive, and we move forward, right? And so one of the things that became very evident to us, and foundations would ask me, other than healthcare, what can we give money for? And without a thought, I said food. People need food. They really, really need food every day. And so one of our staff members, Jameen Williams, who many of you now know, she's out in the street every day, and she really teamed up with Salamanca, and has been able to give tens of thousands of pounds of food a day. And, I'm very thankful to her, because that's what we needed. That's what we need. And so we need support. We need people to believe in ourselves, and really just be thankful and appreciative of the relationships we have and of the community that we have. And I want you all to feel very safe in going into urban. We have done everything possible. We've done some patient satisfaction surveys, and so one of the things that really has intrigued me is, like, how do people feel going back into the center? And by and large, people have said that they felt that we reopened in a proper way and in a safe way. And that's really, really, really good. Very few, you have 2 or 3 that say we went too fast, and you have 2 or 3 that say we went too slow, but the majority are very comfortable with how we handled our opening. And they also are very thankful for all the telemedicine that we are able to do. And so it's been a hard, long time. and I think everybody could vouch for that. But I think we'll be stronger for it. I think we'll all be better organizations. We'll be better members of society for this horrendous experience. And if anybody has any questions, I just want to thank you for giving me the opportunity to speak to you. Gabrielle Torres, who's from my staff and is going to be speaking about Medicare Advantage open enrollment. She runs our Health Information Center, which is a storefront right next to 2 storefronts away from our main site that focuses just on outreach and navigation and insurance enrollment. And when we closed in March, we shut down all of our non-clinical offices, including her office. And she requested not too long ago that we think about reopening the center because there are a lot of people who need to come in and need to bring papers, and it's just not so easy to do through scanning and through the computer. So in a couple of weeks, we're going to be reopening the Health Information Center, and it'll be by appointment, and again, with only a certain amount of people coming in there. We also opened Project Hope a couple of weeks ago. So Miguel Calderon, who runs Project Hope, many of you know him, is in there twice a week and is helping people with applications and resumes. And really, they needed to do a lot of the registration for the GED program and testing in person. So he offered to come in and do that. So that office has been open as well. So we're slowly starting to reopen everything. Our administrative sites, I will say, are going to be closed through the end of the year. 300 people are working remotely from home, and they're doing fine. Many of them have relocated. I have people now in Alabama, Texas, Florida, Puerto Rico, Pennsylvania, Maine, and they're able to work just perfectly. So it's been a big ordeal, but a big learning one as well. So with that, let me stop and see if anybody has any questions.
Thank you, Paloma. Any questions for Paloma?
I do.
Yes.
This is Maggie. How are you? Hi. I want to ask Paloma that since Walgreens closed down, I was thinking that Urban would have taken over, and I noticed that they put a sign for 99-cent store. I don't think that's a good place for that.
Yeah, we didn't consider that at this point in time. We have a couple of projects that are coming up. We have one health center that was just I don't know why. I'm hearing myself. We have one health center that's opening up on Southern Boulevard in East Tremont. We were just surveyed today by the health department. But we had never really considered taking over Walgreens. No.
It would have been great. Anyway, thank you.
Maybe when the next store closes.
Project Hope also doing it by appointment, or can they walk in as well?
No, it's by appointment.
Okay.
Yeah.
Any other question for Paloma? Thank you. On behalf of the health committee, I would like to thank you for coming in. It's good to see you once in a while, because I know you've been in the community work for so long, and I know you enjoy coming into this setting and listen to what the community says, not only about the community but also about the urban health plan.
Yeah. Thank you. Thanks for inviting me. Thanks a lot.
Sure.
Okay.
So now, like Paloma was saying, it's for some people, especially for our Medicare population, it's coming up again, the open enrollment. And like Paloma was saying, we do provide enrollment of health insurance for the people, not only for our patients, but for the community in general. And I believe it was really good to bring somebody who's not an HMO or health insurance, that if they come, they will talk about their products or what they can do for the community. Right here, Gabrielle Torres, who's a enrollment coordinator at the Urban Health Plan. She's going to be able to talk more about the Medicare enrollment in general and how we can help and to enroll people, or how, what the people can do to enroll to Medicare Advantage. So I just want to bring again Gabriel Torres. Gabriel, I know you brought a presentation which we already have on screen, and feel free to start talking.
All right, perfect. Hi, everyone. Again, my name is Jackie. So with this presentation, I kept it short and sweet, but if you guys have any questions afterwards, just let me know. As you guys know, when it comes to Medicare, it's really on a specific base by base. So, by a person and by the situation on how they kind of do with Medicare and just with the plans, etc. So let's get started. So again, I'm really just going to talk about the Medicare open enrollment period. So the open enrollment begins on October 15th, and it ends on December 7th of 2020. During these 3 months, any person who is enrolled into Medicare can select a new Medicare Advantage plan or switch and or drop their current Medicaid Advantage plan. All new enrollments into a plan will be effective on January 1st, 2021. So individuals who are enrolling into a Medicare Advantage plan during their initial enrollment period, basically meaning once they start or once they recently enrolled into Medicare, once they select their plan, they have 3 months to be able to switch their plan or keep it directly to just original Medicare. Sorry, you can switch to the next one. There you go. Perfect. So there are exceptions if a person needs to change or drop their plan outside of the open enrollment period. In order to do so, the individual has to have a reason based on the Social Security and Medicare requirements. These are moving outside of the plan service area, losing current insurance coverage, a chance to get another coverage. So let's say if someone moves to another zip code and there's more options of plans, they are able to then, get into a special enrollment period and switch it. And then there's also other special situations that can occur. They really try. These are just pinpoints, but there's a lot of it really goes in depth. So there's a lot of different types of scenarios and situations that someone can switch their plan prior to the open enrollment period. So to kind of elaborate too, once January 1st hits, an individual, once they select a Medicare managed care plan, they have to stay in that plan until the next open enrollment period. So they will be locked in. Now, to kind of just give some basis, when it comes to Medicare Advantage plans, these plans is just another way to have Medicare Part A and B coverage. So if someone has Medicaid and Medicare, they have full coverage. Now, if they want to pick a Medicare Advantage plan, then they're just going to get additional services. Now, if someone does not qualify for Medicaid, they enroll into Medicare, which covers 80% of their expenses, and it would be good for them to pick up a Medicare Advantage plan because it would pick up the 20% that the straight Medicare does not pick up. So as you guys can see here, more information, most Medicare Advantage plans also include drug coverage plans, so basically for the prescriptions. These plans set a limit on what you have to pay out of pocket each year for covered services to help protect you from unexpected costs. Again, this is a case by case. It's all based on someone's income when it comes to the out-of-pocket expenses and co-payments. Now, there are basically 4 most common Medicare Advantage plans, as you guys can see on the slide. There are health maintenance organizations, so HMO plans. There's preferred provider organizations, PPO plans, a private fee-for-service, and special needs. Now, how they select a plan for individuals is really based on their needs. What services they need, what specialty doctors do they have and that they need to have coverage for, if they need, home attendant services. So it's really case by case, but these are the most common plans that individuals get enrolled into. Okay, so that was really brief on when it comes to Medicare Advantage plans, but just kind of like a little, quick overview. Now, currently right now, as Paloma and even Luis has said, is that currently right now our health information place is closed, so we are working remotely. So if there's anyone in the community that needs assistance when it comes to even Medicaid, applying for Medicaid, applying for Medicare, or even guidance to try to figure out what plan to select, at our office, what we really do is we look at the patient's or the client's primary care doctor, specialty, even certain medications that they might be on, because when it comes down to them selecting a plan, it's best for them to select the one that's going to give them the most coverage. I find that there are times that our clients jump from different plans because Medicare Advantage plans also have OTC, which is a benefit, which actually gives money to individuals enrolled into Advantage care plans, and, they can get over-the-counter stuff. So sometimes they give $140, $130. So that is something that really gets a lot of the clients to try to switch plans rather than realizing, hey, if I switch a plan, my primary care doctor might not accept the plan and it might hinder me. So we really try to give our clients as much information as possible so that they can also learn, and then we can help them, get them coverage in a plan that's going to give them the best coverage. So I, provided our information there, but also wanted to provide on Medicare.gov, they have a very clear and perfect information when it comes to a breakdown, because Medicare has Part A, Part B, D. There's so many parts to it that it can be confusing, but there's a lot of resources on there. And even at the link, as you guys can see, I did a little link there. That also shows, too, if someone wants to do their own research to find out what Medicare Advantage plans are out there in their zip code or in their area, they can look it up and kind of get information. And like I said, always, with our phone number, we are always here to answer questions, to provide guidance. Now, when it comes to selecting a plan, we do have health insurance reps that we built relationships with to be able to, do a warm handoff. So directly at the health information place, we can help enroll into Medicare, help enroll into Medicaid, but the Advantage care plans, that has to be directly through the plan. But we do have certain reps that we work closely with that we can trust that they're going to make sure that these clients are going to be taken care of, and again, we have clients that might say, hey, I want health first. They go and they speak to the rep, but the rep feels, hey, look, your co-payments are going to be really high. We can't cover certain things. These are individuals that we trust that will communicate this, and we'll let them know, look, these are your options. This is how much. If you want to, we don't have to enroll you now. If we can enroll, you can shop around and see what's best and then return back. And then the last slide. So this is actually, I got this off of the Medicare website. It's basically just, quick notes of how to get ready for open enrollment. For anyone when it comes to Medicare, the Social Security office has sent out letters about the open enrollment period and a lot of information. They also have a 2021 Medicare and You handbook that also provides information on plans. If a person does not have it, they can actually request it directly onto the Medicare.gov website, and they'll send it to them. And then also, too, think about Medicare coverage needs. Review basically the prescription plans as well. And then, we're here to always help, to make sure that you pick a plan that is, directly to you and that gives you most coverage. So does anyone have any questions?
I have a question, Gabrielle. You said that by October 15 is when the open enrollment begins. Do you think your office is going to be open by that time or no? You don't know.
I'm not sure. I don't want to say yes and I don't want to say no. But regardless if our office is open, the good thing is they can call us, and a lot of the reps. So the reps can do over the phone. So it's up to the client's comfort. If they rather, stay separate, they can actually get it through the phone, and we can three-way it with them. So we've really found avenues to try to do it that way for right now. But yes, once we open, then it can be more person to person. But for right now, though, we can assist them through the phone with that whole process.
And I think the key here, which is is very important, is that this information could be so confusing, especially for our population, and it's confusing for even for me. Sometimes it's confusing, and the service that you provide there is just to help them to understand the plans, the options that they have, in order for them to make a decision.
Yeah. No, yes, definitely. We have a lot of clients that come to us just with the mail. They'll come with us a whole pack of mail, and we'll open it and we'll read it through them. Read it through with them and see. They sometimes they're unsure. I know that during this time right now it has been difficult for that. But we always try to find different alternatives to try to help them when it comes to that.
Anyone else has a question? Well, Gabrielle?
I'll put my email in the chat, so if anyone has any questions afterwards, you guys can, send me an email, or if you have anyone that needs assistance, I'll put my email in the chat, and then you guys can contact me.
Thank you very much, Gabrielle.
I have a question.
Yes.
Does a person have to select an HMO, select a managed care? Do they have to?
No, they don't have to.
The reason I'm asking is because the long-term side, people don't realize that a lot of people don't talk about long-term, whether it's home care, nursing homes, assisted living. A lot of people don't talk about that. So.
Yeah. Now, when it comes to the long-term, if someone needs home attendant services and long-term care services, to be honest, Medicaid especially, because in order for someone to get home attendant services, they have to be enrolled into Medicaid, right? Or they do a spend down or they do a full trust. But, the hard part about that, though, is that, it's difficult, So most of the time now with HRA, they're actually enforcing, or basically now they're selecting. So they either have to pick up a Medicaid long-term care or they have to pick up a Medicare long-term care. So they're actually making that a requirement now for long-term care services.
Somebody in an HMO, sometimes they have to disenroll. So we have to encourage them to disenroll because a lot of them are not covering long-term.
Yeah. And it's hard. And, again, like we always say, we're always here because sometimes there's different reps that kind of give out wrong information or whichever it may be. It happens, so we try to fix that and try to make sure that they're got the best coverage. So, yeah.
Thank you.
You're welcome.
Any other question or any other comments? No? Thank you, Gabrielle, for coming in. Please give us that information. Anyway, it's going to be part of the minutes. Also, your presentation is going to be part of the minutes, so people will have your information available.
Perfect.
All right. So, moving out in the agenda, it will be the old business. Technically, I don't know if we have any old business since we haven't met since March, but I don't know if anyone has something they want to bring.
Mr. Chair. I just want to acknowledge that you did mention about the last time this committee actually met and that this is the first meeting since March. But I do want to acknowledge that last month we spoke about having DOHMH make a presentation about COVID and track and tracing. And at that time, it was decided to have them present a full board meeting for September.
Right.
But technically, that would have been like a health committee item. So I just want to make sure that we're on record that last month we wanted to capture as many people as possible. I have 15. There's 15 people on now. But at the full board meeting, when Anita gave her presentation, it was 60 people. So I think that was the whole point of trying to, capture as many people that in those resources that Anita provided. So I just wanted a point of reference with that.
Thank you, Ralph. Any new business? No.
The building. What is it? 909 Beck. I already started the interviews for the tenants that are going in there. 28 of the apartments are going to folks in the shelters. So seniors, 62 and over in the shelters. So I interviewed about 50, 55, and so far I've approved only 6. So I'm I'm sorry. I'm really tough when it comes to that. I'm trying not to bring into the community
the people that have, and I hate to say it, have a drug history and look like they're still using. So there's a series of questions that I ask them. So I'm trying to keep the community, as best as I can. 28 apartments are going to the shelters, and the rest are going to just seniors that have put in applications. I have no control over who I'm told to interview. I get a list and I interview them. I don't know who's coming into the building. There was an impression that I was going to put people in front and whatnot. I don't know what the applications say. I don't know where they're coming from. I just am interviewing right now for the people in the shelters. But I'm hearing that maybe November 1st, we will probably start signing the leases for that day. We'll see. I've heard that before. For October, I heard it. Now I'm hearing it for November. So hopefully, let's keep our fingers crossed and we start filling up the building.
And how many apartments do you have in the building?
88.
Oh, wow.
28 is shelter and 60 is regular seniors.
Are you going to have any set aside for people that live in this, like seniors that live in this district?
I don't have control over that, but that is the instructions that were given.
Okay.
That was the instructions that were given. We were focusing on the Bronx, and I wanted it to keep it that way. With the
that's part of the SARA program on the HPD. So any building that's receiving HPD funding has to go through the affordability component, which 50% are supposed to go back. But SARA program is not 50% because these are seniors. So Foxy Management, correct me if I'm wrong, Julia, Foxy Management is doing the startup with this. And when we met with Foxy, we gave them instructions on this building and the community access building at 985 Bruckner on our preference to have people from this district.
That's
so whatever they're giving to Julia is what, they're getting. But that was what was strongly encouraged at the time.
Yeah, I'm working with them because the shelters that I'm getting are only Brooklyn and Queens. I haven't seen any from the Bronx. And I know we have shelters in the Bronx. So I'm really going slow with the process of accepting and not accepting. So, and it's exclusively up to me whether I accept somebody or not. So I'm waiting on the Bronx folks. I still haven't seen one yet.
Mm-hmm. And when do you see people start moving in?
I was told July 1st, then I was told August 1st. Then, now I'm being told November 1st.
Oh, okay, so it's ready. So the people are ready to move in. Oh, just this is an interview process.
This is just the interview process. I've already interviewed between 50 and 55, and I've only accepted 6. And the shelter people have to be the first ones to go in.
Oh, wow. So you have a way to go.
I don't want to rush. I don't want to rush and bring our community back. And I hate to say it that way, but I don't want to do, something in a rush and then we're going back to what we used to be. And we don't want that.
Yeah, I agree.
Yeah.
Thank you, Julia.
You're welcome. And for those who don't know it, I'm spending half of my time in a Manhattan facility in Terrence Cornell Cook, which is also under Arch Care. They fired their director of social services, so I'm kind of like lending them my license. So I'm there 3 days a week, Monday, Wednesdays, and Fridays. So that's why it's difficult to run back and forth. But hopefully I've interviewed a couple of people. Hopefully I'll hire one of them, and my life will go back to whatever normal is these days. So hopefully, within a month, I'll be back fully at St. Vincent. But I'm there Tuesdays and Thursdays. So if anybody needs me.
Thank you, Julia.
Okay.
Any announcement?
Mr. Chair, I think in the chat, Jennifer wanted to talk about, I guess, the services they provide. But
sure.
That's up to you.
Yeah. That's from Open Arms.
Jennifer, you there? Jennifer, you there, Jennifer?
My daughter's just going on. I'm not. Hold on, Emma. Sorry. She's unhappy. I have her in a chair next to me. I just wanted to talk about us a little bit. Next week on the 12th. On the 12th is actually going to be 8 years since we opened, and with the pandemic and everything that's happening, all the social days have actually been suffering.
Right.
There's about 388 centers in New York City alone, and per the mayor's executive order, we have all been shut down, so we don't have in-person services. So we're providing telecare and meals to our clients. But because we're such a niche market, we are under managed long-term care plans, and they decided that they're not going to pay us for the services that we've been providing. So we have pretty much been servicing the clients at our own cost. We're providing masks, gloves, food. We're providing arts and crafts. We're providing essentials. I mean, there's clients who are still afraid to come out of the house, so we're doing food shopping for them. We're doing social services, recertifications. I have clients whose bills I'm still paying. You know, so we were forced to form a coalition. And on April 8th, the Department of Health finally issued some guidance, which the insurance companies have still come to ignore. So we have come together, and what we're probably going to end up doing is suing some of the insurance companies because they don't want to pay us, they don't want to provide the services. They have cut out completely the social daycare from the client's benefit. And we, just kind of looking for a little bit of support from everybody, because when this pandemic is over, if this continues, we're not going to exist. The seniors are going to have nowhere to go. And, it's just been really bad. We lost a lot of clients because their family members aren't able to take care of them. They ended up putting them in nursing homes, and they died within 2 weeks of being in a nursing home. We lost about 10 clients in a 3-month period, which is a lot. So I just want to tell you a little bit of our struggles and, see if maybe you guys can give us some kind of support, help us somehow. But we're going to end up hiring attorneys to start suing the insurance companies because we can't survive on what they're doing to us right now, and we're not going to exist, unfortunately, if we're not, going to take any drastic measures.
Oh, wow.
Everyone, just tell, because not everyone is familiar with where you're from.
Yes, so I'm from Open Arms Circle. We're a social daycare. We're located on Westchester Avenue and East 161st Street. We're under the shade with the same block as Rite Aid.
That's it, Mr. Chair. That's all I have for announcement.
Right. Thank you, Jennifer. I know we have been working with Open Arms for so long, not only through the community board, but also we have done a lot of collaborative work with Urban Health Plan at Open Arms. So let's see how we can help. Just keep that conversation going to see how we can do. Any other announcements? So there's no announcement. I really want to thank everybody for being here today. Looking forward to meet in person. I don't know when that's going to happen, but I'm looking for that day. Hopefully, maybe next year. Ralph, what do you think? We don't know.
Your guess is as good as mine, Louis. I have no idea.
I know. So I don't know if anybody else want to say anything else before we just, adjourn.
I just want to congratulate Ralph on being a dad.
Oh, yeah.
Thank you. Thank you, Paloma. I appreciate that. Yes, thank you. Thank you.
Thanks, Ralph.
Thank you. Thank you so much. Thank you.
Struggle, but for some people it's been good.
Yeah. There's a light at the end of the tunnel, So if I've got to be the light bearer to bring good news, so be it. It's fine with me.
Yep. All the best to you and that beautiful baby.
Yeah.
Thank you. Thank you. Thank you.
We also want
say something.
I'm sorry. We also want to thank all of the new board members who logged on for their first official meeting.
Looking forward to keep doing so much work. Always active throughout
Thank you
the
so
whole
much.
year.
I'm really excited.
Louis, I can give an update from the health department if that's okay with everyone. So thank you so much, Paloma. Thank you to all the partners, the great work that you're doing. I think this is a team effort, and we're going to have all hands on deck, as we're seeing that in other parts of the city, the numbers are spiking. So we cannot, put our hands down. We have to continue. We can't let our guards go. So I just wanted to mention to you, because we are tracking these numbers very carefully, and we're doing surveillance, but we're also looking at neighborhoods that people are not getting tested. And so right now we are observing our neighborhood in the Bronx. And so I just want to tell everyone, please, currently there's still transmission going on, which means that there are people out there that have the COVID virus. Sometimes they don't have symptoms, but they're still able to transmit the virus. So it's very important that we all understand that in order for us to know if we have the virus, we have to get tested, right? That's number one. But if you're sick, you should stay home. Do not go out. You should wear a mask when you go out. When you're in the supermarket or the bodega, make sure that you're 6 feet away from each other. And it's also very important to wash your hands. If you're in and out, wash your hands. That's very important. That's the way that we're going to track this virus and make sure that it's gone. The other thing I wanted to mention is that it's flu season. And it being flu season is important that everyone gets their flu shot. I have to say that, this year is more important than ever, because you don't want to get sick, right? Because you don't know if it's coronavirus. So we really want to tell everyone to get out, go and get tested, and also get your vaccine. So that's in the Bronx. We've seen that we've had almost 5,000 people die of coronavirus, right? And so I think that partly because of that, people are really helping in terms of complying with the guidelines. So we want to continue doing the same. So thank you to everyone for everything that you're doing.
That there's some neighborhood that are not getting tested.
Yeah, so
in the Bronx. Do you know which zip code?
Yeah, so the first one that we saw, and this was back in July, it was Tremont, 10458. We saw that people in that neighborhood were not getting tested. And the numbers, the percentage of positive was higher, than the average of the city. And then we went to Sunset in Brooklyn, and then we came back to the Bronx, and we were in 10472 in the Soundview area. And so I know that Urban Health has St. Lawrence in that area. And we're still, tracking, but we did have a good turnout. We had over 2,000. Our goal was to test 2,500 people, and we did exceed what we were looking for. So what I want to say is that we want to flood these neighborhoods with information. We want to flood them with testing sites, and we really want to make sure that everyone understands the importance of getting tested. Okay? So right now we're just looking at data every day, and so my job right now is 24 hours a day, making sure that we're checking, and that we're talking to the partners to see what they're hearing. And so I want to thank the partners, because really we've been hearing what messages work, what messages don't work, and, trying to make sure that we have an educational campaign to continue this work. And until we get this COVID vaccine, it's going to be hard. We're going to probably continue. So I just wanted to say thank you.
Actually, now that you're saying that the New York State Department of Health, I guess also the New York City, they encouraging people to download this app, which I downloaded the app, and what is really good about the app is that besides that, it keeps you informed. If you again, you have to be honest, and if by any chance you feel like you're sick, that you were tested positive, and you were around people that had the virus, you put that information in the app, and it happens that if everybody's doing it, and let's say I pass by Anita, and Anita also has the app, and she put her information that she was tested positive. When I pass by, my app could connect with her app and send the information to DOH, and they send me back the information, say, hey, you were close with somebody who was positive, and they kiss me like give me a warning so I can go and test myself. I think it's really good. What I'm gonna do, I'm gonna put it as part of the agenda of the minutes, so everybody can have access to that app, and if they want to download it, you can download it, because I think it's really good to use it.
Yep, and it's a state app, and it's called NY COVID Alert. All right,
right,
so everyone wants to see it, and I mean, like, they're using this app like in China, right? That's how they're tracking down the virus. When we talk about test and trace, you know, the word trace, especially in Spanish, it's like, you know, you're tracing people, but that's not what we're doing. We're tracing this virus, right? Because we want to make sure that we are aware of where this virus lives, and we could capture it and not continue to have it, you know, replicate or transmit to others. So thank you, everyone.
All right. Thank you, Anita. So is anyone else, any comment, anyone add anything else to the meeting?
One more, and I promise I'll be quiet after that.
Okay, go ahead.
The
we haven't
seniors.
been together for so long, so don't worry.
I know, but I love all of you. The seniors in the community, I know what I went through, and I know how it felt. It felt like I was in a deserted island, and the community totally abandoned us. Not one person in the community came by to see if we needed anything. Till today, not one. Do we look at the folks in Irma Cava? Do we look at those folks and make sure that we're doing something for them? Make sure that if they need anything, I mean, food. I could tell you, I was in St. Vincent sometimes 15, 16 hours a day. I couldn't get to a supermarket. I saw everybody getting food, and I was like, wow, it would be nice if somebody bought us a couple of boxes of food here so that we can, you know, take it home to our families. Not one community group. And that hurt. That hurt so deep because we were suffering. We were totally abandoned. Can we look to see if the folks, at least in Irma Cava, the seniors, let's look for the seniors and see if they need anything. Can we take them anything? Is there anything we could do for them? Because I know what it feels like firsthand.
I'm really sorry to hear this, but I just want to let you know that the health department, we do have facial masks, if that's something that we could give to the seniors. We also have hand sanitizers, and I also have a couple of other things that I could probably, you know, give them if that's something that, you know, they're interested in. So, Louis, just let me know, and I'm happy to connect.
Reach out to Sal at SEPCO, and just besides Irma Carver, we got Mendez. Those are the two senior homes in our district, and they're both operated by SEPCO. So we can certainly reach out.
Cordova Houses.
In Cordova Houses. Oh, yes, I'm sorry, in Cordova Houses. But we can reach out regarding Irma Carver and then Pio Mendez to SEPCO and just see where they at with things. I've been in communication with Sal throughout the pandemic just to touch base. He has not mentioned anything to me as far as a need except for masks for some of his staff, and I hooked him up with Suri from the mayor's office. So Suri dropped off, I think, something either 500 or 1,000 masks to Sal for that. That was the only thing that he brought to my attention, but I could certainly follow back up with him with that.
Thank you, Ralph. All right. So it's 6 o'clock. Our meeting is over. Once again, thank you everybody for coming in. And we look forward to have you again next month. Is the first Tuesday of each month at 5 o'clock. So the meeting is adjourned at 6 o'clock. Have a great night and great week. Bye-bye. Take care.
Bye. Nice seeing everybody.
Bye. Be safe.
Take care.
Bye.
Take care.